with my ADHD patients, they're the ones that are the hardest on themselves, right? And they're doing the most. And sometimes, like, well, I spend a lot of sessions be like, what did you do right this week? What went well this week?
This information is helping a lot of women make sense of what's happening for them and why they might be struggling.
And then it was really resonating with a lot of people, with a lot of women. And then they started looking into the data and the research and seeing that a lot of women not been diagnosed when they were children a lot. They didn't present with the hyperactivity as much, so it wasn't as easy to spot out.
Have you noticed that increase in ADHD in women, and why do you think that's the case? Dr. Thea Gallagher is a clinical psychologist, assistant professor at the University of Pennsylvania, and director of the outpatient clinic at CTSA, with expertise in exposure therapy and evidence-based treatments for a range of conditions, including anxiety and ADHD. She is committed to advancing mental health awareness and providing practical strategies for well-being. She's a trainer and sought-after speaker, frequently featuring on NBC 10, Fox 9, and other national media outlets, as well as hosting a podcast. Dr. Gallagher brings her extensive knowledge and thoughtful insights on ADHD in the modern world. Stay tuned.
I'm Dr. Thea Gallagher. I am an associate professor at NYU, a clinical psychologist, a consultant, a trainer. I also do a lot in the media and communications space and the wellness space. So, yeah, I do it all because I do like to help people. I love all things mental health. And lucky for us, mental health has only become more popular, especially post-pandemic. But it's, I feel like I always wondered if I picked the wrong kind of doctor specialty to go into, because it's less lucrative, but we're very popular. And sometimes I feel like a celebrity, you go to a party and you tell people you're a psychologist and everyone's very interested and wants to know kind of behind the curtain. And it feels like it's very enlivened, psychology and mental health. So I think it's a great time to be a psychologist right now.
Yeah, that's so true. Actually, I haven't thought about that, but it is such a shift because I remember previously when I first became registered, people would almost retreat from you, like, "Oh, can you
Hmm.
read my mind?" Like, whereas
Right.
now people really lean into those conversations. That's so true. And I mean, the pandemic has shifted a lot, and I noticed one of the things that it has changed is there's a lot of people seeking out assessments for ADHD, in particular women. I don't know if it's the same in the States, but here in Australia, there's up to 12 months sort of wait list or longer, because there's such high demand for those services. And I'm
Hmm.
wondering, have you noticed that increase in ADHD in women, and why do you think that's the case?
Yeah, I mean, I think statistically it's the case. And it's interesting how, art imitating life. I think a lot of people were becoming more open about it on social media, TikTok, and then it was really resonating with a lot of people, with a lot of women. And then they started to look into the data and the research and seeing that a lot of women had, not been diagnosed when they were children. A lot used to a lot of that because they didn't present with the hyperactivity as much, so it wasn't as easy to spot out. But I think some of the other symptoms, the more people have learned about them and understood them, I think unfortunately and sadly, a lot of women started to say, I'm, self-diagnosing or seeking out an assessment for this because I saw a TikTok video that made me wonder if this is me. And I don't think it's because somebody wants to just wear that diagnosis. I think a lot of people can resonate with the symptoms, and I think with a lot of neurodivergence, looking at it really as a spectrum. And the more that we have changed that way of looking at it, that it's not you're in or you're out really, but it's more of like a spectrum. And which symptoms do you have and how are they impacting and affecting your life? And I've spoken to a lot of ADHD researchers in the last number of years, interviewed a few on various podcasts, and it's been really interesting to also talk to them about how the way we do this assessments, the way we understand ADHD in women, how it looks, and also that for a lot of women, they may not have been diagnosed in childhood because it might not have been as much of a problem. It might not have been impacting their functioning, their schooling in the same way. But I know for myself, I got diagnosed as an adult, when I had more responsibilities mounting on my plate. And all of a sudden, I was like, I cannot keep up and I don't know where to start. And I'm extremely overwhelmed. And every day I feel like I am chasing my tail. And I think it is interesting that for women, one of the reasons why they probably don't get diagnosed earlier is maybe, again, it's not impacting their life as much, but with the mounting responsibilities, the job, career, motherhood, it can become much more difficult to manage.
That makes so much sense. And I think in the pandemic, obviously, I mean, there's pressure put on everyone, but particularly women around the amount of responsibilities and that mental load, and women trying to juggle, being a mum and doing homeschooling and work and all of the things. So it sort of makes sense that we started to see that shift around that time. And as you said, like that positive role that social media played in terms of increasing awareness. Can you tell me what are some of the differences between, the way ADHD may present in men and women? And I also love that you talked about it being on a spectrum because I think we can get so caught up in the idea of diagnosis and not everyone will meet the criteria as we know for a diagnosis of ADHD. But I think what really resonated with me when you were talking is that this information is helping a lot of women make sense of what's happening for them and why they might be struggling in key areas, even if they don't have ADHD, but they're struggling with some of the symptoms, which I'll get you to talk about. But yeah, what are some of those differences between how ADHD or ADHD symptoms may present in men and women?
Well, definitely, I think when we're looking at children, the hyperactivity piece might not be as present in young girls, and it might be more present in boys, and we see the more inattentive type in women. And then I think with these skills of executive functioning, again, I do think there's some expectation for women to just be good at executive functioning, even in meetings. Hey, you take notes, you're the organized one. And I think there's just the societal expectation that men can be more disorganized, their bathroom's a mess, their backpack's a mess. And that expectation isn't for women. I do think that maybe as a result of that, you're trying to fit in, you're trying to be as organized, you're overcorrecting. And I think for a lot of young girls, and then as they head into being young adults, maybe again, we're really overcorrecting or working twice as hard as people without ADHD, and they didn't even realize it. I think that's one of the things that is so powerful with talking about it even more. But yeah, these executive functioning skills, time management and time blindness and organization and focus, and knowing, how to organize a project or something that you're meant to do. I know even for me with school, there would be certain challenges, but at the same time, I knew, okay, this paper is due on this date, and it was because the aspect of it having some structure to when it was due and how I had to get it done in a certain time frame, and it was kind of acute. There's like, this is the syllabus, and this is the stuff you have to get done. It was almost a roadmap to get you there. And especially, I think with school being more structured when you're younger and almost making the path for that organization, this is the thing that you work on, this is what you have to turn in tomorrow. There's a lot more high touch in the maintenance of getting things done when you're younger and in school in that way. And then you have to be a little bit more self-motivated as you get into college, but you still might have these deadlines and things that you can predict and plan for. And then when the real life happens after college in work and the deadlines are kind of on you, they might be there. But then also, how do I manage all of the deadlines of work? And then if I'm in school on top of that, and then maybe again, I have children I have to take care of and organize, and I have my friends. It can feel again very overwhelming when all of these pockets start to kind of mesh with each other. So I think this idea of struggling with those executive functioning skills really come into play later as well.
That's so interesting because I'm very aware of like the difference between in children, when you see obviously we know, and I think it's quite well known that ADHD is um, underdiagnosed and not picked up enough in girls and potentially overdiagnosed in boys,
Mhm.
unfortunately. But, that shift as we change and the societal expectations on women, it's so fascinating that idea that, when those roles are somewhat contained and structured in school, we're able to manage it. But as we get older, it becomes a different ball game because there are more and more expectations, I think, placed on women as you age in terms of those roles that you need to play. It as we talked about earlier, the many hats that you're wearing. And so that executive functioning becomes even more important in the roles
Mhm.
and the expectations that society puts on. So it makes sense that at that point, potentially, I'm wondering, like, are women sort of burning out and then picking up the ADHD component at that point, unfortunately, when they have actually started to burn out or it started to really affect their mental health?
Yeah, absolutely. I think we're gonna see more of that, um, the more we explore and understand, but definitely, I think that theory tracks that you're overcorrecting, overworking, and I even had a patient I was talking to the other day, really was high achieving, overachieving in high school, got to college, and all of a sudden the self-motivation and the self-organization was not there, and then they became really depressed and almost weren't able to do anything. And that's also this interesting combination we see with ADHD and anxiety and depression. And some of those symptoms have crossover, right? I'm a lot of times talking with patients like, is it ADHD? Is it anxiety? Because some of the symptoms can look the same. And I know for me, looking back, so a lot of my anxiety was coming from my ADHD, feeling like I wasn't getting to these deadlines in the way that I wasn't I felt like I was never catching up with anything. I also think some of that is a perception too. Like, sometimes I'll be like, "Oh my gosh, I need to get back to this person. It's been so long," and I look and it's been 24 hours. So, I think there's this right, there's this constant thing that I'm always like, "Oh my gosh, I have to be forgetting something." I know because I have in the past, and then sometimes though, because I've overcorrected in so many ways, like, my keys go in the same spot every time. I know that if somebody asks me to do something, I'll say, "Hey, can you do that over email?" Because I know that's a place that I take very seriously to keep myself organized. And I know I've learned kind of strategies over time to help me kind of keep things organized. But I do think you're right. So many women may have been overcorrecting and working extra hard, working double time to the point that they are burnt out. And I also think that for women, there's less room for error. I remember I would go to job interviews and they would be like, "Oh, are you an organized person?" And absolutely not. But I wouldn't say that. I think I couldn't say that. And so and now I've learned that, okay, I'm not. I do these things to help me stay organized, but I have other strengths and I see myself more as a thought leader and big picture thinker. I figured that out. I even took I got promoted to this one role as the director of our clinic, and I realized I'm like, "I can do this job, but I don't like doing this job." The amount of admin and organization it was requiring of me was burning me out because it wasn't bringing me joy. A lot of it felt like a chore, and I needed to realize that, especially if you have ADHD, we know that if you aren't really excited about something and can't find your passion in the work, it is torture. And I think knowing that and kind of coming to terms with those things is also really important. And a little bit of a side note too, I was talking with my partner about this weekend. I've been trying to think about activities that help me kind of stay mindful recently, and I really like cooking, and that's I always have wondered how that fits in with ADHD in a way. I really like it. I think it's very rewarding. You can see the reward kind of quickly. It keeps you engaged. I really like food, so I think all those things together can help. But I hate laundry, and that's the last I would pay so much money to never do that. It feels very banal and mundane. And it's just, ugh, it's, like, so hard for me. But I know there's some other women that were like, I would like to never cook again. I can do something like laundry and that sort of thing." So I also think figuring out those things that do connect with maybe your deeper passion or excitement or finding ways to connect to those areas is also really important. But I think as a woman, I don't know if we're allowed to have that place of exploration or say, "I don't wanna do this." But if a man said, "I don't enjoy cooking or laundry," I think we'd be like, "Oh, okay, like, you can outsource those things." But I think for women, we can end up taking it very personally or something's wrong with me. I should be this way. Other women are clearly so organized and organizing their kids' birthday parties in this perfect way, and everything that they do is so maternal and organized, and they have everything they need in their backpack for their kids. And I think, I think it's kind of nice that more women are kind of coming out about being what we call. And you'll see these videos now of like I'm a kind of a type A, type B mom. Even those areas, realizing that there is a community of us who aren't maybe as put together as the quintessential Instagram mom.
I think there's a lot of us that don't fit
We have
that
to stick
category.
together.
Of course, of course. I love that. And I love that you're sharing that publicly because I think it's so important to break down those stereotypes. And I love what you said before about, in your relationship, it's not just addressing the kind of societal expectations of what a woman should do or what the role needs to look like, but what you're doing is really shifting that communication. And I think that is a real strength because that is what we need in relationships. Like, relationships are about saying, "Hey, like, I'm really good at this thing," or, "Hey, I enjoy this thing and you enjoy this thing. So, like, I'm not gonna do that, or let's outsource that," and having that really good communication. And I'm wondering, what other strengths do you think people with ADHD type symptoms, or um, yeah, what are some of those strengths that people with ADHD may bring to a relationship? Because I think we can get caught focusing on all the difficult things and the challenges, and we'll talk about that in a moment. But there's a lot of strengths there, and I think
Mhm.
that when we can come to our relationship from that place, when we can say, "Hey, like, these are the things that I'm good at, these are the things that I enjoy," and your partner does the same, that's when we start to find that balance in our relationship and that happiness, and we can share the mental load, and all that good stuff happens. So I'm wondering, what do you think are some of those strengths?
Yeah, I love that question about strengths. I think that's so important, and it's so interesting because with my ADHD patients, they're the ones that are the hardest on themselves, right? And they're doing the most. And sometimes, like, well, I spend a lot of sessions be like, "What did you do right this week? What went well this week?" Because I just think people can be so hard on themselves for the thing that they messed up and forgot instead of all these other things that they have done well. So I love talking about strengths, but I think in relationships too, I don't I think this idea if you just are gonna fall into the traditional gender roles, again, a lot of them are gonna be heavy admin on the women, right? In the workplace, in the home, with your partner, and if that's not your strength, that if those aren't your strengths, you might have to, uh, talk about that differently and have an open discussion about the things that you're good at or not good at, and get away for the, "I should be good at this," or, "This is like so many women I know can do these things easily," and they can get their laundry done and wash it and fold it and put it away the same day, and, I think it's important to kind of understand your what you are good at and what you're not good at. And I know my partner and I really struggled when we moved in together. It was probably one of the hardest times in our relationship. He is extremely organized, very clean, very detail oriented. I always say I'm like so impressed if he wants to do something, he makes like a 10-step plan to do it. He's very linear. I am tangential. I'm a big thinker. I am like visual. I'll get an inspiration here. I'll have, this happen. And I'll be like, oh, I'm gonna do that. I get like bursts of energy or bursts of motivation. Um, and again, if those were just listed on a piece of paper, the things I just listed, they're strengths for both of us, but they're different. And how do you make them work together? And it took us a number of years, but we were like, first we were like, this is not gonna work, and then figuring out how do we get our styles to actually complement each other, because he could make phone calls all day to, like, insurance companies, and he'd have a great time, and, if he has to solve a problem, and it's tedious, he's great at it. That is not my strength, and so figuring out what is my strength and what am I bringing to the table here, but also, I think, yeah, you have to know what those strengths are, and especially in the business of a relationship or the business of a relationship with kids, there are some things that need to get organized, and how do you divvy them up and really play to your strengths? But I think it also comes back to really trying to create an equitable relationship where for many years, and a lot of the research is showing this, a lot of working moms, um, work and then are expected to do a lot of the traditional roles at home too, and there's just not enough time and not enough energy, and even we had to talk about that, like, my job, is very, requires a lot of me mentally. His job doesn't require as much of him mentally, and also, you have to get into the nitty-gritty of what are we each bringing to the table, and how can we bring that to the table, and how can we share these roles? So it's a combination of factors, but I do think this factor of, on top of it maybe being hard for you if you have ADHD, to not then have equitable roles. Uh, if you're both working and you're both contributing, you need to figure out how to work through that. But when it comes to strengths, I also again, I love to have fun and it could be these big picture aspects of our relationship and these big picture things with our kids, and how to get to those places, I think, are where I shine in our relationship. And then I do know the things that are hard but have to get done, and I have, built in behavior economics into my life. Token economies are a part of my life. Working in kind of more shorter spurts with like a very clear outcome is helpful. So I think thinking in those ways, and also just having I have certain, organizational plans in place too for how to keep track of things, especially as regards to, like, my kids and our lives. And so I think knowing where I have to have those, and even something silly as a shared calendar, right? It would be like, "Oh, okay, I told you this thing." And I'm like, "Oh, I totally forgot that." So, can we over communicate and over put things in the calendar, because I might forget by the time we get to that point. Um, but then I have this this really strange elephant memory for things that happened like 20 years ago. So, I think also knowing where your brain is stronger and less strong too.
Oh, absolutely. And, when you're talking about that dilemma you first had in your relationship around identifying the differences and feeling like, can this work? I think that's such a common question. And I have that come up all the time in couples therapy, whether people have been together for a year or 20 years, is sort of like, wow, we're so different. Can this actually work? And what we know is those differences actually really complement each other. So it's more about, understanding those things, understanding those strengths, understanding and the things we enjoy, because something can be a strength and we may not enjoy it, but understanding, what is the strength that I have? What is the strength that you bring? How does that complement? And so that communication is key. And I think you're so right in that a lot of people with ADHD, in my experience clinically, do feel like they are, taking away from the relationship in some way, or that their partner has to live with them and their ADHD. And in my experience, I often think about when couples come to therapy, there's always one person that's sort of the champion for the relationship, that's sort
Mhm,
of carrying a lot of the relationship load, and that tends to actually be the person with ADHD. So
mhm,
they're actually doing a lot more work in the relationship. Of course, I'm stereotyping, but that's what I've seen, and what you're sort of describing is that, because unfortunately that person may have had struggles throughout their life, maybe in school, friendship difficulties or bullying, and as they get older, difficulties in the workplace, they tend to be more sensitive to that, unfortunately. And so they take that internal dialogue on. So therefore, that means that they are actually doing a lot more work in the
mhm,
relationship generally and on the relationship itself. So I think that communication is so important, because when we can talk about it, we start to see, oh, actually, there's a lot I'm bringing to the relationship. There's a lot that I'm adding to the relationship. And there's all of these strengths that I have and the strengths that my partner has too. And when we can just actually start talking about them, being really open, honest about, yeah, but there's this thing, this is just not me. And I think that
mhm,
talks to all relationships, doesn't it? Where there's things that we
mhm,
don't like, where there's things that we're not good at, that we need to have that communication, and that's how we kind of, get through and
mhm.
have a happy, healthy relationship that's a bit more balanced.
And you have to watch out for those shoulds, because we talk about them a lot in CBT,
Mm.
that they come internally. But I do think sometimes early on in a relationship, they're going to come from your partner too, because they don't understand you. And
Yeah.
so early on in our relationship, Steve would say, you should know that, leaving those clothes on the side of the bathtub is not like cool with me. And I was like, truly, I don't even notice them. It's not a should for me. So I need you to communicate what is important to you. And I would say that, like, from that shame place too, so many people are like, "Hey, oh, trust me, I don't want to make anybody upset and frustrated. So if that's bothering you, that is something I can work on." But we can't come from this place that I think you have to realize that you're two very different people with very different brains, and your brains work very differently. And so how can you be clear about something that you want? And that would take some vulnerability on his part to be like, "This is bothering me. Can you do this because for some of us, we're just not going to even notice that. That's not a priority to us. And I said, we need to over communicate because the last thing I want is you to be stewing and resenting me for something I didn't even know I was doing. And I think for a number of years, I had this like small voice in my head that kept being like, you're a disaster person. Like, you can't, like, these things that come so easy to people. And you really have to work yourself out of that because then I would write down like things I was doing objectively. And I'm like, wow, that's a lot of stuff. And it's big picture stuff and it's really cool and exciting. And I had to, almost keep track of it and give myself the credit for that. And the more I could accept those things, doesn't mean I'm not working to become more organized in certain areas, but it's also nice to know those aren't my strengths and where I could outsource certain things, and I'm like, I actually I'd rather work more hours and have certain things outsourced because if I'm, like, seeing an extra patient or doing some consulting for an hour where somebody else could help me with my laundry, that's gonna be better for me, and so I had to also advocate for myself for that in a relationship and get away from the shoulds, like, yeah, I should want to maybe do all of these, admin type things in my life, but I don't, and so, again, some of them I can't take out of my backpack, but the ones that I can, um, I'm happy to pay for and work more to be able to make that dynamic work out. But it was really important also to see that what I was bringing to the table was a strength to it. I love the quote. I saw it a number of years ago, and it really helped me so much. Is that people with ADHD make hard things easy and easy things hard. And I am the type of person that if you said right now, "Thea, at the end of this, you have to hop on a live news show," I'd be like, "Oh, great, perfect. I'm ready to go. Happy. Whatever they ask, throw any question at me. I'm there, totally there." And I don't kind of overthink certain things, which again, I think complements my partner who can tend to overthink and be so methodical and so step by step. And sometimes I'm like, "Ugh, I don't know, good enough. And I think even a lot of the literature about maximizers and satisficers was so helpful for me because I know that there are some people with ADHD and perfectionism. I am not one of those, thank God, that I struggle with. So I can really be like, I'm a good enough person. I'm like, if it's good enough, come on, we can do it, or let's just go for it. And he doesn't
Yeah.
work that way. And so sometimes I do see our strengths complement each other because I'm like, I can't, like, this is too tedious almost. I'm going to do a little bit of research and then I'm going to execute on the decision and make it happen. So I think you have to advocate for yourself and see your strengths. And it's nice kind of to see them juxtaposed maybe to a person who doesn't have those same uh, difficulties, but they might not have those same strengths. And it's nice when you can make them work in a relationship as well.
Can you just talk about, because some people might not be familiar with that language, when you said maxifiers and simplifiers?
So the idea of, maximizers are people that do a ton of research before they make a decision, and maybe to the point of over researching it. And they look into all, they're going to buy a pair of shoes and they're going to look on every possible website and get the best deal that they can possibly get. And but then they may have spent 3 hours buying a pair of shoes, where satisficers it's this idea that, maybe kind of make a good enough decision. They might not do all the research, maybe they do enough, and then they make the decision. The interesting thing is that they found that the people who spend all the time thinking and perfecting and kind of being perfectionistic in the decision making, they may have objectively made the best decision. They may have gotten the best shoes at the best price on the best website in the best way, but they were less happy because they have to keep doing that system every time, and it can be very tedious and overwhelming. It can take a lot from them and a lot of time. And so a lot of the research shows that the just good enough people, maybe the decision wasn't exactly the best, but in some ways it didn't matter and they were happier because they weren't belaboring decisions. And I think that's really important. And figuring out that's a strength of mine as well that I can. And it's funny because you might have grown up in a family where perfectionism and doing things the right way and the perfect way and methodically was told to you. And ever since I was a child, I remember people would tell me, like, "Let me see your work or see how," and I would be like, "I don't know. I think I did it the wrong way. I didn't do it the way I was taught." I remember I took piano lessons. I didn't wanna read music, so I would watch my teacher's hands and kinda memorize how she did things, and then I would play, and it was the wrong way, per how to read music, but that was my way. And so I think also sometimes I don't know exactly how I got from point A to point B, but I did and it's working, so I'm just gonna go with it. And I think people that are a little bit more linear, a little bit more step by step, sometimes can get stuck on those things, and they might not be able to make those decisions, and they might end up finding that they're overwhelmed with more anxiety and stress because there's so much pressure on these decisions. So the good enough is something I do think more people with ADHD can kind of relate to because you have to just sometimes make those decisions.
I love that model. We talk about that obviously in parenting as well, and I think that, that idea of just shifting your perception, shifting the way that you think about things and identifying, as you said, where that comes from, those narratives that we've grown up with or those narratives that maybe society's placed on us and shifting that. And, as you said, it shows like the data's there that making those decisions and not overthinking thing actually leads to greater happiness, which is really important. You also touched on, anxiety and mood, depression. Can you talk a little bit about the crossover between ADHD and anxiety or depression?
Yeah, I want to. And I just one thing that I thought of from what you just said, I wanted to bring up. So I'm one of four, and I had an older brother, older sister growing up, and they're very, very smart, and always kind of were very by the book growing up with how they learned things. I remember I came along and I was like slow to read. And I remember my parents, I could feel that they were like worried about me that and they never thought, I just knew that they never thought I was as smart as my brother or sister. And interesting how life works out. But I've gone on, to have two master's degrees, a doctor, postdoctoral fellowship. And recently, I'm 40 now. My dad and I are getting together. He started to get like worked up. He's like, I have to say, you're like my greatest surprise. And I thought that was so interesting and it was really sweet, but he didn't really understand. And so I think they saw my kind of non-traditional methods of figuring out things or getting things done. Um, and they didn't know how that was gonna end up working out for me, and probably for good reason, right? Because school models are very, kind of traditional, and there's one way to do things. And it was nice to have that moment with my dad who, I think he, maybe was like, how is she, you know, how is she gonna get through? How is she gonna figure these things out in life if she doesn't do it in this very linear fashion?" So, I think also, like, those narratives can be deeply ingrained, from childhood as well.
I'm
And
really
and this
glad you
yeah,
highlighted
mhm.
that because I think like we can look at, we get so focused on the challenges of ADHD, but we know that some of the most successful people in the world have ADHD because ADHD comes alongside a lot of strengths. So it is that creative thinking, it is that capacity to think outside the box. And as you said, you think in a different way. And I think that we can get stuck as a society looking at this is the way kids should learn. This is the way our school system needs to look instead of looking at what does this individual need and how do we help them to achieve their potential. And I
Mhm.
think, it is so important to highlight that there are so many strengths that come alongside, having ADHD and the way that your brain works in a different way is actually a really positive thing.
Yeah, and it puts more of the onus, I think. I have a lot of thoughts on education and even, extracurriculars, but I think it puts the onus on getting kids excited about things because, it did take me a while to read and there were things that were very boring to me in school growing up. Um, and now I end my night on Wikipedia every night. I'm so interested in learning things. And I think that pressure should be on our teachers and parents. Like if you can get kids excited, if you can tap into that passion and that excitement, you're gonna see someone, especially with ADHD, do the most. If you can tap into what really interests them, what kinda keeps that spark alive, and I think, in some ways, shame on the school system, in some ways for years past of really a focus on, like, rigor and some of this boring stuff that is important, but if you can find a way to make it interesting, if you can find a way to tap into people, and that happened for me with psychology, right? The human brain and how we do things and why we do things is endlessly interesting to me. And so finding a way to really tap into people's interests and passions and keep them excited, that's not just on the child to okay, I have to keep doing something that I'm supposed to do, that I should do, but that I have no connection to. And I think it's great because I think the school systems are changing. They're letting kids read more books that they want to read, right? You might
Yeah.
discover a passion for reading if you like what you're reading. You might not want to just read to read, but I think, really igniting that flame for people is and for children especially is super important. I think for you as an adult too, if you start to feel like life is feeling like tedium and a chore, it might be time to start trying to find a way to tap into your deeper passion there.
Mm. I love that. And before when you said that idea of like, I can do this thing and I can be successful in this area, like you were talking about, I think a position that you were going for or that you held. But I don't want to. So it's sort of even if I can do this, it doesn't mean that I should do this. So,
Mhm.
it is about obviously finding the things that are our strengths, but also finding the things that we are passionate about because that is how we prevent burnout as well. That is how we take care of ourselves is doing things that we enjoy. So I really, that's such an important thing to highlight.
And you might sacrifice a title or prestige along the way, but again, because of this idea of the Peter principle that people tend to reach their level of incompetence, we tend to keep saying yes to promotions until we're out of our depth, we're not excited, we don't enjoy it, and then you're on a fast track to burnout. So sometimes you have to maybe sacrifice the flashy title, and stay true to yourself and stay
Yes.
true to what you need to do. Some of my friends run these private practices, and a lot of psychologists end up going into fields where there's a lot of admin, CEOs, and that is not where my career is heading. And the sooner I accepted that, it was really freeing actually, and it was honoring to myself and my strengths. Like why keep trying to build I have very, thin arms, right? If I'm going to the gym and I keep trying to bulk up, probably time to give it a rest. That's not gonna happen for me. That's not how my body is shaped. It's not how it's gonna work. And so it's kind of like that is knowing where like why am I working against myself to prove something to some
Mm,
people? And I
mhm.
think saying to yourself, just because I can do something doesn't mean I want to do it. And really, for someone with ADHD, if you don't want to do it, it is going to feel like a slog every day. So you have to, I think, find those things, and it might mean making sacrifices along the way. But I found the more I've said no to certain opportunities, and this is what a lot of successful people will tell you to do as well. Saying no to the opportunities that really don't fit for you, that don't really scratch an itch, then you're going to get more of the opportunities and the things that you really want to do.
Absolutely, because it creates that space for it, doesn't it?
Hmm.
So I want to talk a little bit about, yeah, that connection with mood and anxiety. And this is actually
Yeah.
really what we're talking about because I think this is one of the things that contributes to that is when we try and put ourselves in a box and try and pursue a path that doesn't make us happy or that puts, a lot of load on in terms of the tasks that are required. So what is some of that connection? Because I think people can get confused about that, the connection between ADHD and anxiety and depression.
Yeah. So I think it depends on for so many conditions, right? What's primary and most interfering? And you have to go back in your history too to maybe understand a little bit about like what came first, and what's actually making you anxious right now. So I have people who, let's say, I work with a lot of high achieving college students in my time working in universities. And some people, they'll come to me, they're like, I think I have ADHD. I get really stressed about, test taking and studying. But then you kind of dig deeper into it, and it's really about like perfectionism. It's not an attentiveness, it's not an organizational issue. It's really more that I'm very anxious. And so I might avoid studying because I'm anxious that I'm not going to do well. Or especially in the OCD world, sometimes with anxiety, rereading, rewriting, doing things over and over, maybe not turning projects in on time. And you might think, oh, this is an ADHD thing when really it might be a perfectionism and avoidance and anxiety piece as well. And I think with depression, right? Depression and anxiety both impact concentration and focus. So it's really important to get a good evaluation and to tease out like what's impacting the concentration and focus. Is there a lot of, and again, we were talking about negative self-talk with ADHD, like what's chicken, what's egg, and what's impacting. Is it that I've been really depressed and now I can't concentrate and focus and I have no motivation? That might be originally inspired by the depression, which is now looking like some ADHD symptoms. Or is it that I don't know how to focus and organize and keep track of things and people are upset with me and now I'm depressed because I don't, because I'm losing my job or because people again are frustrated with my organizational or lack of organizational skills. Or I just feel like I can't get ahead of anything, or I might be overcommitting to things, or I have this time blindness and I keep being late for things. And then people are upset with me. And now I'm upset with myself and anxious. So I think you really have to tease apart what came first and what's maintaining the symptoms over time as well.
It's
I
yeah,
think
so
another piece on
it's
that
I
too
think it's yeah,
is
go.
the medication, right?
I was
Because,
gonna say that, yes.
because, and this is something I'm working with a lot of my patients because you can have also both, right? Anxiety and ADHD, they might be interrelated and separate, but doctors are kind of careful because sometimes certain stimulants might make somebody who has primary anxiety more anxious. Where for me, I can vividly remember the first time I took a stimulant and I was immediately calm. Like I could have taken a nap, and the calmness that came over me and my ability to figure out which thing I could focus on, it felt like my life just went into immediately, like, I could see everything in a filing cabinet. It was so helpful for me to see which thing I could pick out. But for some people with anxiety, they might notice, maybe an increase in some of, like, their anxious thoughts or feelings or even in their physiological response, and that's why I think it's so important with the diagnosis and then with the
Mhm.
plan for what you do about it.
Can you talk a little bit about that, the treatments for ADHD? Because I think, as you said, obviously, firstly, it's so important that we get the diagnosis right. And this isn't
Uh-huh,
about labeling people. If you don't want to have a diagnosis of ADHD, that's fine. But it's more about if you are going to obviously go down something like a medication path, we need to make sure that we're very certain about that
uh-huh.
because the implications of giving people the wrong medication, obviously, across all diagnoses, can have devastating effects on someone. So, can you talk a little bit about, I guess, some of the treatment options for ADHD? Because I think also there is a bit of a myth out there that the only treatment for ADHD is
Uh-huh,
medication,
uh-huh.
and medication may not be the right treatment for some people.
Yeah. I will say of all of the psychiatric conditions, maybe schizophrenia aside, I will say that the gold standard treatment for most people with ADHD is medication. And I as the starting point, I think they've figured out that you can, CBT for ADHD can be really helpful. Just, executive functioning groups can be super helpful in creating those skills and tools. And I think together it can be a really good combination because the truth is also there are times in your life that you might not be able to be on a stimulant. I know I've been pregnant 3 times and the research isn't really there and there's some it's hard so having those skills and tools I think is also really important to have and to work on them and a lot of it too comes down to not only the executive functioning skills but that self-compassion work as well to really work on that inner work can be really important to kind of accept yourself uh, as who you are with your identify those strengths work on some of the things that you can't take out of your backpack. Um, but, the good news is there are a lot of also really robust, stimulant medications. There's also some non-stimulant medications for ADHD that can be helpful. There's new research even around things like Wellbutrin, kind of trying to understand if that's a good fit for somebody who might have that anxiety and ADHD combination. But again, there's so many skills and tools that you can learn. But I wouldn't if you're very I think I always tell people if you're very worried and suspicious about medication, do a lot of research about that. If you're very, suspicious and don't want to try anything, cognitive behavioral skill wise, you should probably look into that. So being open to understanding where the research is guiding us and taking us is really important. There's also just a lot of stigma about mental health medication that I think is problematic, and it might be good for us to just, we don't think about psychotropic medications the same way we think about insulin or the same way we think about an asthma inhaler. And so I understand the desire to understand more research, and I do think also, though, some people don't, wanna put their kids on a stimulant, and I understand that there's concern, but make sure you're doing the research, you're talking to your doctors, you're really trying to and not you know, not the WebMD research or, like, Doctor Google research only, like, making sure WebMD is great, what I mean is making sure that you're talking to psychiatrists who specialize in this and that you understand all of the options that you have for you. There's also a big myth about people, abusing stimulant medication, and that's just not true. I mean, it can happen, but this is not, there's a lot of kids with on ADHD and part of their treatment is getting them to be adherent with their medication, because for some time, some of them they feel like, oh, it's kind of like makes me boring, or I'm not as fun as I am. So there's a lot, there's a lot to discuss around that aspect of things. But there are other options as well, but making sure you're kind of open to really understanding all of the things that can possibly impact your health and mental health. And I think breaking stigma around medication is really important and seeing what works for you. I think one of the neat things from researchers that I've talked to and psychiatrists is that the interesting thing about ADHD medication is that it works a lot of the gold standard frontline treatments, they work pretty immediately. So if it
Yeah.
doesn't work for you, you don't have to take it. And so that's the other thing where a lot of SRIs, you're going to have to build up to 4 to 6 weeks to even say if it has an effect. And for ADHD medication, it might be a little bit shorter for you to figure it out and learn from that. And I had a psychiatrist was telling me recently too, when people are coming in and really looking for ADHD medication with like an immediate effect, they want an instant release, they want, a high dosage of that. That might be, making sure that you're really talking to your psychiatrist about maybe getting an extended release, a longer acting medication to see how that helps. That kind of disabuses the idea even of maybe someone trying to abuse it as well.
Mm. I want to talk about two things there because I
Hmm.
think this is such an important topic in dispelling some of those myths around ADHD and medication. And as you said, like we know with ADHD, when the medication works, it's pretty instantaneous. So and there's a reason for that, right? Because there's such a biological component to ADHD. So I firstly want to talk about just a bit of that biopsychosocial, and so why medication is so important for something like ADHD, whereas may not be necessary or as necessary in as majority of cases for something like anxiety or depression, for example. Is in the general population, the way people would think about ADHD in terms of I might have symptoms of ADHD. So a lot of people might read information about ADHD and strategies that we're talking about ADHD will be really helpful, but they wouldn't meet a criteria
Hmm.
diagnosis for ADHD. So the difference between that, because obviously if someone is identifying with symptoms of ADHD, but they don't have ADHD, then something like medication is not going to be a relevant pathway for them. But still, some of the strategies that we talk about with ADHD can still
Hmm.
help if we're struggling, say, with inattention, for example.
Yeah.
So
So
let's start with the
with
biopsychosocial. Yeah.
Yeah. The biopsychosocial in the sense of I think you have to understand what are the factors too, because in our society, there's a lot of people, a lot of us who are very overcommitted and and this some of if you're saying like maybe some of the people that are sub threshold as well, it might be just that they're overwhelmed by life because life is very busy and chaotic, and the goal of treatment might be to, hey, you got to pare down some things. You're actually like just overwhelmed and you have very little mindfulness in your life. You're going, you have very little self-care. You're feeling anxious and overwhelmed and can't focus and can't keep track of things because maybe you have too many things on your plate. And that can happen to both people with ADHD, subthreshold people with ADHD, and just the average person, right? Can happen. So I do think it's really important to kind of understand all of the factors that are playing into the symptoms that you're having and how long have they been around, where have they come from, and I'm not a psychiatrist, so speaking to the mechanism of action of the medication, is something definitely to talk to your psychiatrist about and how they stimulants and then non-stimulants and even things like Wellbutrin, they don't trying to figure out the exact mechanism of action of how it works to kind of help slow down certain things and put other things kind of into focus and help to almost slow down the rapid firing of the brain and be able to focus on the things that you need to focus on. So I do think it's important, even with all this information about diagnostics out there for the general public, making sure you're getting a good evaluation. Because again, if you have anxiety or depression primarily, you don't necessarily want to go on a stimulant. That's not going to be, it might not be the best route for you. And there might be a low dose SRI that might be able to kind of help with this feeling of overwhelm and anxiety that might actually be coming from that place of anxiety, where somebody else who's really maybe struggling with some of the other symptoms we were talking about might do a lot better with a stimulant medication. And then it's really important for your psychologist, psychiatrist, evaluator to really kind of get a sense of how all of these interplay, and are woven together because that might determine the kind of medication that they're going to prescribe for you. And the cool thing is, though, is you can do a little bit of like trial and error, and you don't have to do a 6 week trial and error. You can do a lot shorter of a time frame to see how does this work for me, what does it work for me, and I really encourage people to monitor their symptoms. But being also overscheduled and overwhelmed might be a problem that needs to be addressed as well in therapy, and that's a different kind of issue.
Yeah, and I think what you're really highlighting there is that when we take those components away, so when we address the psychosocial components, if we have ADHD, that biology doesn't go away. And that's
Uh-huh.
where the medication does help to shift things because, if we are able to go to therapy, if we're addressing those things or we're removing those stresses from our life and we're still having those symptoms, then that is telling us that there's a biological component here that needs to be addressed through
Uh-huh.
medication, which is, what we see in ADHD.
Uh-huh.
And can you tell me a little bit about, and I think you've touched on it there, that difference between, you use the word subclinical, which I know some people won't know what that means, but we're obviously very familiar with. Can you just talk a little bit about like what we would think of someone presenting with like symptoms of ADHD? So what people might go, oh, yep, that's me. I do those things versus someone who might be more heading towards subclinical and a clinical diagnosis of
Yeah,
ADHD.
I think it always comes down to, is it interfering with your life and functioning, to really meet the criteria. But for some people, you might find that you're distractible. Also, I mean, I think many of us feel like our phones are really distracting us from our lives, and that can be hard. We can feel very distracted. Again, as responsibilities mount, I think it can be hard. Some of us just don't feel like we're keeping track of things. But when I think it's when the symptoms remain and the background changes, that's really what you wanna see, what is still persisting over time, and it's more of a way of kind of, interacting with the world, that maybe proves to be more difficult over time, or just kind of, again, that forgetfulness or losing things or disorganization or inability, again, to attend to something for a period of time, and there's a lot of great, um, tips and tricks and skills to work on those things. But I think maybe just feeling, distracted or feeling stressed or overwhelmed is not actually going to be what we're talking about when you meeting the criteria. But you might watch those videos on TikTok. I mean, most of us can look at pretty much any disorder in the DSM and be like, oh yeah, I have a few of those. So you just want to see, how are they happening a lot of the time, more than half the time? Are they starting to interfere with your life and functioning? Are they causing other secondary effects, again, like maybe anxiety or depression because you feel like
Mhm.
you can't ever catch up?
Mhm. What are some Speaking of TikTok and social media, what are some of the myths that you've encountered about ADHD or mental health in general on social media?
The biggest myth to me is that they're not treatable. That's the thing that's the only thing I get mad about. I love that we're bringing awareness to these symptoms. I don't think every symptom, if you relate to one of them, means you have ADHD, but a lot of the memes are right on. Like, I read them, I'm like, "Oh my gosh, this is hilariously accurate." Like, so I do think there is some truth. There's a lot of truth out there, but where there's not truth is that I think with a lot of I'm glad we brought awareness, but there's a lot of evidence-based treatments that exist that can help you. So I think some people are like, "Yeah, I have this disorder," or "I diagnosed myself on TikTok." All right, well, you can do something about it. And I wish we had more information out there about, there are treatments. Go see someone, see a psychologist, get evaluated. Also, go to a skills group, executive functioning skills group. Learn some skills from a CBT manual for ADHD with your therapist. Maybe get on some medication, but there are treatments out there to help. And again, I think there's also this myth that I like, we were talking about this a little bit before, but I like that we're saying the world might have to also change to accommodate neurodivergence. I do think there's a part of that. But also, there are certain things in life that they work the way that they work and they're not going to change, and certain organizational skills that we need to work on and focus on and do. So I think also, this idea that all parts of it are great and helpful, instead of looking at it, it might be a superpower that we need to learn how to hone and control and manage a little bit better. And I think, for me, and you have to tinker maybe with your medication or with different things, finding a way that you can feel the most yourself. We don't want you to be someone else, but how can you maybe find some skills and tools or medication that actually help you to do the work that you want to do? And that can be really freeing to get that clarity, to get that ability to focus on the things you really want to focus on, to maybe kind of calm down the white noise that's swirling all around you. So I think don't be afraid of the evidence-based treatments that do exist, and realizing that the goal is not to numb you out or to make you a different person, but to really hone the fullness of who you are and to get you to be that. And I hope that we can have more kind of positive information about neurodivergence, but also saying it can't just go completely untreated. There's things we can do about it that will only help to enhance an individual's quality of life ultimately.
Mm. I love that idea that, because I'm so passionate about this myself, that focus on, change is possible, and that change is not taking you to a place of being less of you, it's taking you to
Mhm,
a place of being more of you. Because I
mhm,
think in my experience, I'm sure you've experienced the same, that's a huge barrier for people accessing support is they don't want to change who they are, and no one wants them to change. Like, who you are is beautiful, you're perfect who you are. But what we're talking about is maybe some coping skills that reduce the stress in your life,
mhm.
for example. So, absolutely, it's such an important message that that change is possible and that change is moving you more towards who you are, not taking away from that. I want to ask you one last question. If you had a magic wand and you could give every human on earth one skill or one piece of knowledge, what would it be?
Every person on earth, I would say you just can't take life and yourself too seriously. I think in all of the things that is I always come back to that touchstone, and I think Oscar Wilde says something, about not taking certain problems too seriously, but it is true. I think life is absurd, things that happen in our lives are absurd, and we need to find the absurdity in it, and I think taking yourself less seriously and accepting even your foibles and the areas that you mess up and being able to laugh at yourself and laugh at life, I think is really important. And from what I understand, I've heard uh, Australians like to laugh a lot. So I don't know if that's true. So I've heard that is a welcome sentiment.
It's a very welcome sentiment. I have to hold myself in check actually on podcasts a lot because I laugh too much and it makes editing like really difficult. So I find myself sometimes like silent laughing, just trying to like hold it in because
Well, you've got
uh
it. That's the key to life. You're nailing it.
it is. It's not the key to podcasting, but it is the key to life. On nailing silent laughing for
Yes,
podcasting.
yes, exactly.
Thank you so much for your time. It was such a pleasure talking to you. I know that I could talk to you for hours. There is so much knowledge in there. And just as a person, I could just see, that good intention that you have to share this information with others and to help them live the life that they want. So thank you so much, Thea.
Thank you so much. Happy to be here. This is a great conversation.
Subscribe for more conversations filled with new insights, inspiration, and practical tools to create a life you love.